Answers, uncovering the truth. Boston 25 News investigates.
Governor Maura Healey's 2026 budget calls for cuts to programs for children and teenagers with the deepest mental health needs. Advocates turn to 25 Investigates, saying the reasoning behind the cuts doesn't tell the full story. They tell me these residential programs are for the kids with no other safe options.
They just keep showing up through the revolving door in the hospitals, or they just don't feel they're safe to go home because they're still imminent risk of harm to themselves or others. Those kids wind up in our programs.
And those programs are on the chopping block, says Lydia Todd, Executive Director of Northeastern Family Institute, or NFI. NFI's programs serve thousands through the Massachusetts Executive Office of Health and Human Services. The ones in jeopardy are here in Westboro. The dual residential program has 30 beds for kids ages 13 through 19 who enter an acute crisis.
This is at really the deepest end of mental health needs for kids in the Commonwealth.
Todd says she was recently notified by the Department of Mental Health budget cuts proposed in Governor Healey's new budget included them.
I think that is a mistake.
This New Bedford dad says their child's stay in Westboro saved their life. We agreed not to identify him to protect his child's privacy.
It's heartbreaking on a daily basis, and without the support, it would also feel hopeless.
The dad says their child has many conditions, including suicidal ideation. During their 9-month stay in Westboro, his child received psychiatric and medical oversight, behavioral therapy, and peer support groups. Todd says the reason for the cut, the program's only at 50% capacity, so the state wants to consolidate it with another youth program. But she believes utilization is not due to a lack of need, rather a sluggish referral process bogged down since COVID.
You've been raising the red flag on this for a couple of years, and now do you feel penalized by how slow the process has been?
It feels that way, but I think it's also tough if you're a commissioner and you have to make cuts and you don't have a lot of time to do that, and if you look just at utilization, but it just never tells the whole story.
The Department of Mental Health tells 25 Investigates that consolidation will ensure taxpayer dollars are used effectively and will save the state more than $15 million. A spokesperson noting the administration has also expanded access to care through 31 community behavioral health centers.
I think it's a shame, and at the very least we have to hold the children and families harmless while we explore this.
These facilities are critical to the safety of children in our state, and if a state is not supporting the safety of its children, it's not really supporting anything.
Another facility being cut, a program for children ages 6 to 12 in Belchertown in Western Mass. It's the only intensive residential facility in the state for children that young.